Hi there, this is Elliott Martin,
And I'm Becky Hatfield.
and we're coming to you from opposite parts of the country to bring you all the ins and outs of Medicare and your health insurance,
We are asking,
and answering all your Medicare questions so that you can proceed with your healthcare and wealth planning and make a confident decision. This is the Medicare Navigators Podcast. Hi, everybody. Welcome in. My name is Elliott Martin. I'm with Martin and Associates Insurance Services, and we are an independent insurance agency. We're located in Irvine, California, is where our main office is, but we are actually licensed in about 30 different states and help folks all over the country with their Medicare day to day. We are talking about every day, talking about Medicare with individuals. So welcome in.
hi there. My name is Becky Hatfield. I am a stay-at-home mom and the social media manager for Martin and Associates. I'm over here in North Carolina.
And today we're going to be talking about the different parts of Medicare.
So, Part A and Part B, what we just talked about, that is original Medicare. And that is what is included on the red, white, and blue Medicare card, correct?
Right. Yep, that's
Okay.
correct.
So now we're kind of shifting the conversation a little bit to Part C.
Mm.
And Part C is code for Medicare Advantage plans. Is that true?
Right. Right.
Okay.
Part C is Medicare Advantage. It's kind of like an alternative an alternative program to the traditional Medicare system. And Part C Advantage plans are kind of like privatized Medicare plans. So really, I think this goes back maybe even before 2003. Congress, there were HMO plans within the Medicare system. I'm not sure, I just started in 2014, so some of the history here on Medicare I'm not completely up to speed on, but I believe in 2006, really the today's Medicare Advantage program was, I think, developed in 2006. That's really where it started in its current state. And basically, Congress thought that, hey, we need to give Medicare recipients an alternative way to take their Medicare benefits, as opposed to keeping the traditional Medicare system, which has been around since the 60s. Instead of that option, we need to just see if we can give folks another option. And this is where they came up with the idea for Medicare Advantage, and kind of like a privatized Medicare plan. A lot of them traditionally have been HMO plans. There are some PPO plans under the Medicare Advantage umbrella. I like to call it an umbrella, Part C of Medicare, as these different set of privatized Medicare plans. So if somebody does decide they want to join an Advantage plan, they would actually be assigning their Medicare card completely over to the insurance company they pick. So when they go to the doctor, they don't show their Medicare card anymore. For people in an Advantage plan, you just show the insurance card that you've selected for your Advantage. You can leave your Medicare card at home, because that's no longer your primary insurance. Medicare Advantage, when you join anything labeled Advantage, that is taking over your Medicare rights. And how it works is they are subsidized plans. So Medicare Advantage, if somebody joins an Advantage plan, that plan is going to get paid by the federal Medicare program. It ranges between, maybe $800 to $1,000 a month, roughly, per person that joins an Advantage plan. So that is the financial incentive for these Advantage plans. And really, it's insurance companies that offer Advantage plans to promote their plan and develop an attractive plan, because, hey, you can join an HMO for no monthly premium in a lot of places throughout the country, and they'll put a cap on your out-of-pocket exposure. Depends on where you live, but it can range. You can be as low as $199 for the entire year, max out-of-pocket on an HMO, but in other parts of the country, it can be thousands of dollars in out-of-pocket potential. So it's kind of like just an alternative way, really, that folks can take their Medicare benefits if they don't want to go with the traditional Medicare system and pay extra money for a supplemental plan and a separate prescription plan, which we'll get to a little bit later. But it's really just an extra set of options available.
What is the primary reason that you see a lot of people choosing a Medicare Advantage plan over original Medicare with, let's say, a Medigap supplement?
So probably a couple, I mean, some of the major things is a lot of the Medicare Advantage plans have no extra monthly premium. So you don't have to pay anything extra monthly. And they do put a cap on your out-of-pocket exposure. So that's another nice thing where is if somebody's walking around just with their Medicare card, there's an endless amount of out-of-pocket potential if you just have the Medicare card and that's it. At least on the Advantage plans, you have a cap on your out-of-pocket exposure. And, if all your doctors are within the same medical group, if it's an HMO plan that you're looking at, that can work out perfectly fine. And really, you're not going to see much difference in your access to providers because you've always gone to these doctors within this network.
Mm,
And there are certain extra bells and whistles on these plans, vision, dental, hearing aid benefit. Sometimes they'll provide you meals after hospitalizations and transportation. So these Advantage plans, because there's so much funding going into them, they are able to offer benefits that go above and beyond the normal Medicare covered set of services. So those are some of the reasons why somebody may be attracted more towards Medicare Advantage than the traditional Medicare system.
okay, so I get that they are covering some of the out-of-pocket potential and all of that, and if you just stick with A and B, original Medicare, there's all of these potential money sucks that could
Yeah.
come up, long stays in the hospital, long-term care, all of these things. And so it seems like Medicare Advantage plans are swooping in like Superman, saying, like, we're here, like, you're not going to have to pay as much money. We're going to give you all these perks. So there has to be a downside. Like, why wouldn't someone choose a Medicare Advantage plan? Because it sounds really attractive on the outset.
Yeah. The plans are very attractive. I think the biggest thing is that you're opting out of the traditional Medicare system, which that's the system that gives you the nationwide access wherever you'd like to go without needing referrals and no network restrictions. So once we join an Advantage plan, we've opted out of that traditional system, right? And we've assigned over our Medicare benefits to the insurance company. And it's really up to the insurance company to build a network of doctors. If it's a PPO, it's either going to be a set of in versus out of network doctors, or on the HMO plans, they have to work with the medical groups. These insurance companies have to have contracts with the medical groups, and they've got to keep that relationship going between the insurance companies and the medical groups. And if something like down in San Diego for next year, San Diego, this big medical group, Scripps medical group, they've ended nearly almost all their contracts with Medicare Advantage. So I
Mhm.
think I saw a news report where something like 25, 30,000 Medicare Advantage members in San Diego were set to be dropped from Scripps unless they
Mm,
made some sort of plan change, which they could do. But that's a lot of scrambling and a lot of extra work and a lot of headache and a lot of administrative stuff that now that's putting into the system. So we're a little bit at the mercy of the insurance companies to continue to provide a good product, have a good network of doctors that they have relationships with, keep the doctors happy, keep everybody happy. It's a little bit more volatile from what I've seen on the Advantage side, where things can change, and of course you can make adjustments if there's any drastic changes, but it's just a little bit less predictable. Whereas the traditional Medicare system, it's been around since the 1960s. It's worked pretty much the same as it was intended to and gives people great access, great freedom of choice. So it's just a matter of taking that into account before you join an Advantage plan. But that's probably a big reason why somebody would not want to join Advantage is they don't want to risk losing doctors or having to scramble around. They just want to keep access to their doctors without fuss. That would be more of a reason to stay with the traditional Medicare system because that's the
okay.
more stable, probably been the more stable system.
Okay. So explain to me this third way. So we have I'm healthy, I'm fine, I'm just going to have Medicare Part A and Part B. We could do that, but you're taking a lot of risk because
Right.
there's lots of gaps in coverage. So
Right.
then the second way you could go is I'm going to sign all my benefits over to Medicare Advantage private insurance company.
Hmm.
They're going to cover some of those gaps. but it's kind of a hormonal teenager and that it could go one way one day, one way another day. Is there a
Can
third
be.
way?
Well, so are you thinking of the Medicare supplements?
Yes.
Okay. So yeah, there's a third way to kind of cover your out-of-pocket exposure on Medicare. And really, I like to call this the first one, really the first way,
It's
because this
not the
is
third way. It's
no, this is the
number
first way.
one.
This is the more I mean, the way in our opinion, this is our opinion, but in our opinion, it's the best way to keep your access open and limit your out-of-pocket exposure, right? To accomplish those two things at the same time, you would do that by adding on Medicare supplement insurance, or they're also called Medigap plans, to go secondary to your Part A and Part B original Medicare benefits. So you keep your red, white, and blue Medicare card as primary, and then you purchase a Medicare supplement to fill in the out-of-pocket gaps or the out-of-pocket expenses on Medicare. So that's the best way, in our opinion, to one, keep your access wide open wherever you'd like to go, and just fill in the out-of-pocket exposure on Medicare is to add on a Medicare supplement. Okay, and really the go-to supplemental plan or Medigap plan is a Plan G as in golf. And the Plan G, it fills in all the out-of-pocket expenses on Part A. So hospitalizations, you would actually have 100% coverage in the event of a hospitalization within certain bounds. I mean, there's somewhere in the ballpark of 500 consecutive days that you would have 100% coverage. Beyond that, Medicare stops covering. Okay, hopefully nobody ever spends that much time in the hospital, but between Medicare and your supplemental G plan, you have 100% coverage. Skilled nursing, 100 days of skilled nursing covered at 100% between Medicare A and your supplement, your Plan G. And then for the Part B services, really the only out-of-pocket expense that you're going to be left with if you add on a Plan G, for example, is going to be the $240 Part B deductible for 2024. After that, Medicare will pick up 80%, right? The Part B will pick up 80. Your Plan G supplement will pick up the last 20%. So that's almost 100% coverage. Now, there is an extra monthly premium that individuals do have to pay for a supplement. Usually it's going to range, maybe $100 to $200 a month at age 65 throughout the country. And it's going to vary. It really depends on your zip code, which, what the premiums are going to be, who's competitive, which companies are competitive. But that would be the Medicare supplement insurance. And we like to call that's the Cadillac of healthcare. You get nationwide access wherever you'd like to go and close to 100% coverage for your medical services. Pretty great.
I like how that sounds a lot. I feel like it would bring tremendous peace of mind because from year to year to year to year, nothing's going to change. You can stay with the doctor you like to see. You can go see a specialist if you need to. If you end up in the hospital for a long time, you're not paying so much money out of pocket. It just sounds like a really good option.
Yeah. Yep. It's a great option. If it's within budget, it's really what we would normally suggest for folks. But everyone's situation is a little different. So there's not one size fits all answer to the Medicare equation. It really depends on each individual's
Yes,
means and what they're looking to accomplish with their health insurance.
I think that that's a good statement, just that everyone can afford different things. And I think that's why it's good to be with an independent agent that can help you exactly where you are geographically and what is in your zip code and all of that.
Thank you so much for listening into the Medicare Navigators podcast. We have a weekly Medicare 101 webinar that we would love to have you join us on. Go to our website at martinmedicare.com to reserve your spot today. Please join us again next week as we continue this conversation. All information related to this episode are listed below in our show notes.